Good afternoon. It is Wednesday, May 31st, 2023, and this is our Protect Our Province live briefing on pregnancy and COVID-19. I am Dr. Susan Kuo, a rich and family physician, a clinical associate professor at UBC, and a member of Protect Our Province BC. Protect Our Province BC is a nonpartisan, nonprofit grassroots organization consisting of doctors, nurses, engineers, health scientists, and community advocates striving to keep the people of British Columbia safe by sharing accurate information about COVID-19. We begin respectfully acknowledging that we are broadcasting from the traditional, ancestral, and unceded territory of the Coast Salish peoples, specifically the Musqueam, Squamish, and Tsleil-Waututh nations. We are grateful to the Indigenous peoples who have cared for this land since time immemorial. As settlers, we commit to do our utmost to uphold the Truth and Reconciliation Commission and work towards the 94 calls to action. We are very happy today to have Dr. Genevieve Eastabrook to join us. Dr. Eastabrook is a maternal fetal medicine subspecialist and a clinical researcher with a focus on placental dysfunction and cardiovascular problems in pregnancy. She has a special interest in providing pregnancy care for marginalized populations, including people who use drugs. She also is an advocate for reproductive justice and for the LGBTQ2S and neurodivergent communities. We'd like to focus our discussion today on the risks of COVID infection to the pregnant person, the risks of COVID infection to the fetus, treatment options available for COVID in pregnancy, and wrap up with how to keep safe from COVID infections while pregnant. We'll also have some resources for pregnant people. Let's start with the risks of COVID infection in pregnancy. So, Dr. Eastabrook, you mentioned in our conversation last week that you consider pregnancies with a COVID infection to be high risk. Why is this?
So I think a lot of it comes down to the unique physiology of pregnancy and also some of the changes to the immune system that take place. So sometimes people consider pregnancy as a stress test for the rest of your life. And so oftentimes conditions are unmasked by pregnancy for the first time. And so it's a clinically vulnerable time for some people. In addition, there's a lot of changes in your physiology during pregnancy. Your lung volume is smaller, your blood vessels are more dilated, you have a higher cardiac output, and there are some subtle changes to the immune system that make it more likely that you can have worse infections with viruses and other organisms. And so, putting that all together, it would make sense that people would be vulnerable, particularly to respiratory illnesses. Now, what had been observed is, during the first waves of COVID, and especially the Delta wave of COVID, pregnant people were certainly having very significant illness. They had a high risk of becoming critically ill, a high risk of needing invasive ventilation, a high risk of preterm birth related to that. Now, fortunately, as things have progressed, because of people becoming vaccinated and also with the changes in the virus itself, with the Omicron variants, there's a multitude of those, obviously. We are seeing less severe acute illness with COVID, but in the under-vaccinated and unvaccinated population, that's still a significant concern, as well as with people who have other clinical vulnerabilities, such as pre-existing high blood pressure, increased BMI, and diabetes. And we have a large number of pregnant people who also are on immunosuppressant medications because of pre-existing autoimmune conditions and inflammatory bowel disease.
That's very interesting. Thank you very much. What is the incidence of miscarriage and stillbirth in pregnant people who have had COVID-19 infection?
So I looked at the most current kind of literature reviews on this because there's a number of meta-analyses putting these together. Reassuringly, it actually doesn't seem that first trimester miscarriage is more common with COVID infection, even in the first waves of COVID, and it was more of a concern with infection in second and particularly third trimester. When we look at the unvaccinated population based on large meta-analyses, the odds ratio of having a stillbirth with COVID infection is 2.4, so more than double the baseline risk. Now, granted, the baseline risk of stillbirth is still relatively low, but it more than doubles that risk. And likewise, in an unvaccinated population, the risk of neonatal death is more than threefold. And much of that would be to do with prematurity related to people with critical illness. Now, again, a lot of these analyses were done at the time when vaccination wasn't available or during the Delta wave of COVID. But it's also important to note that these were in unvaccinated people. On the other hand, people who are vaccinated against COVID do not seem to have this substantial risk, particularly of stillbirth or neonatal death, and it substantially decreases the risk of preterm birth related to COVID infection.
Wow, I didn't know there was such a difference. Now, often patients are asking, after they've had a COVID infection, should they wait to get pregnant?
So there's not a lot of specific advice around that. I think typically, people need to see whether they're back to their baseline. It's as with any significant acute illness in pregnancy. If you're suffering with a chronic cough following COVID, or are having issues with persistent gastrointestinal upset or POTS type symptoms, potentially that can be an issue with trying to conceive. On the other hand, I think, in a vaccinated person who's had a mild infection, I think as soon as you're feeling ready, I think it would be very reasonable to go ahead to try to conceive. But again, that guidance is very variable depending on what the impact of your infection has been.
Now, we know that pregnancy itself increases the risk of blood clots, and even mild COVID infections can lead to higher risks of heart disease and stroke. So are pregnant patients who've had a COVID infection before or during pregnancy at higher risk of cardiovascular disease?
That's a really tricky one to unpack because COVID infections are so new. Certainly with people who have had a very severe infection with COVID, invasive ventilation, et cetera, they have lots of long-term sequelae related to that. Now, in the non-critically ill population of people who have cleared an infection, that's a little bit more difficult to say. There are some studies in non-pregnant people showing that there's increased arterial stiffness, worsening of lipid profiles, increased risk of development of diabetes and cardiovascular conditions. But again, this is based on a mixed population, from large hospital registries, including like Veteran Affairs hospitals and that kind of thing in the US. But it is a consideration, particularly because we are seeing this in people of reproductive age. It's not just the elderly. And so I think it's something that we have to keep in the back of our mind, that potentially if people are trying to conceive and if they've had any symptomatology that's persistent or new, to get that investigated by their primary care provider before they embark on a pregnancy.
Should we be putting any of these patients on, say, secondary prevention, say with anticoagulants like aspirin?
So there doesn't seem to be any evidence for things like Fragmin, for instance, in pregnancies impacted by mild COVID during pregnancy, because that has been looked at. The big question is whether or not COVID, being post-COVID is a risk for things like, preeclampsia and cardiovascular disease. There isn't a lot of data suggesting any evidence-based management. For people who have post-COVID syndrome, particularly those that may have, cardiovascular manifestations such as POTS, or who have developed, new onset hypertension, for instance, after COVID, then certainly I think that a consideration of low-dose ASA would be appropriate. But again, that's really anecdotal based on a very small number of cases, and there's just not a lot of literature.
Yeah, I can understand that. Now, are there other conditions that are increased in pregnancy with a COVID infection?
So certainly during the first COVID waves, wild type, alpha and delta, there seemed to be a coincidence of preeclampsia and
Mhm.
severe COVID illness. And one of these questions is it a chicken or egg phenomenon? Are you more likely to develop preeclampsia because you have poorer cardiometabolic health going into pregnancy, and then COVID is a tipping point? Or does COVID, because of its effect on ACE2 receptors, actually increase the likelihood of preeclampsia? And that's something that hasn't really been sorted out completely. Now,
Mm.
fortunately, we're not seeing that degree of severe, illness requiring hospitalization, in the post-vaccine and Omicron era. So, there doesn't seem to be a huge relationship there. There was some data presented at a scientific meeting that I was at recently where they looked at markers of placental function and also uterine artery Doppler, which is basically
Mhm.
blood flow to the placenta, in patients that had mild COVID during pregnancy.
Mhm.
This was a vaccinated population, and they didn't find any difference in placental growth factor and uterine artery Dopplers, which suggests that there probably isn't an increased risk of preeclampsia and fetal growth restriction in that specific subset of patients. Now, this is
Mm.
all preliminary research, based on a relatively large cohort, but somewhat reassuring, post Delta. Now,
Mm.
the other question that sometimes comes up is there an increased risk of gestational or, de novo diabetes? Certainly there's been a lot of evidence of that for children with an increased risk of type 1 diabetes.
Mhm.
I haven't seen the data on that, but it's certainly something to consider because it does seem to have an effect on metabolism and potentially pancreatic function. But again, we haven't really seen a lot of guidance on that and a lot of solid information about whether or not that's going to be an up and coming concern.
Yes, we're really so new into this. Um, Now, are there some crucial tests would you recommend pregnant people with COVID have?
Yeah, so right now there isn't a whole lot that we can do other than potentially monitoring fetal growth. And so the recommendation in our community, based on the evidence that has been published on COVID infection, is that there could be a relationship with fetal growth restriction
Mhm.
with COVID infection during pregnancy. And so many people are offering a late third trimester, i.e. 34 to 36 or 32 to 36 week growth ultrasound. And the pickup has actually been relatively low. But
Mm.
again, this is in a highly vaccinated population, and most of these people have had mild illness. Now, on the other hand, people with further comorbidities or who have required hospitalization or supplemental oxygen certainly are at risk of an
Mhm.
increased risk of fetal growth restriction. And so those people do need to be monitored more closely.
Mm. This leads to my next question. So, um, an August 2022 report from Stats Canada showed that 15% of people in Canada who had COVID infection are now developing long COVID. So, with people that have had long COVID, are their pregnancies going to be managed differently?
So I'm really glad that you brought that up because this is a very poorly understood and poorly researched area. Interestingly, when I was looking at data around post-COVID syndrome, as I'm sure it is more common in women than in men, and it
Mhm.
is more common also in people of reproductive age.
Mhm.
And one of the concerns is actually one of the papers that I looked at suggested that up to 25% of people who develop COVID during pregnancy have prolonged COVID symptoms that would put them in the criteria of long COVID. So it would be more common to develop long COVID if you develop COVID infection during pregnancy, which
Mhm.
I found quite surprising,
Mhm.
but obviously concerning if you're going to be doing a lot of caretaking for a child
Wow.
afterwards and are having these symptoms. Now, on the other hand, people who have pre-existing post-COVID illness or long COVID, it's really difficult to know how they're going to respond to pregnancy because, again, it's very new. And, I think also that post-COVID syndrome is quite pleomorphic, right?
Mm-hmm.
There are so many different manifestations and different clusters of symptoms that can occur in people. Now, anecdotally, some people with post-COVID syndrome actually find that they have a remission of their symptoms in early pregnancy, similar to what we would see with some autoimmune diseases such as multiple sclerosis.
Mm-hmm.
And we can also extrapolate some symptomatology and expectations based on other post-viral and post-infectious syndromes like ME/CFS or POTS, where again, as with many other sort of autoimmune and chronic disorders, some people will remit, some people will stay the same, and some people will get worse. But I think that there's really not a lot of evidence to suggest, that there are great tools to tell us who is going to behave in which way.
Mm-hmm.
So I think that this is a really exciting and really needed area for research, and also for understanding the needs of people with post-COVID syndrome who may be considering a pregnancy.
Thank you very much. I'd like to now redirect and talk about the risks of COVID infection to the fetus. So, there are studies now have shown harmful impacts on the fetus when people have a COVID infection during pregnancy. Could you tell specifically about some of these conditions?
Yeah, so there certainly seems to be a growing body of evidence of some neurodevelopmental concerns, with various types of questionnaires being done in early childhood. But I would say that there are a lot of confounders, in that, people who are seeking care and participating in these sort of studies may have concerns to begin with because of having a novel infection during pregnancy. And
Mm-hmm.
they're also very short term. But this is also not without precedent. We know that other infections during pregnancy, things like influenza, CMV, may contribute to neurodevelopmental problems. There's some evidence of potentially ties to increased likelihood of things like, autism, ADHD, schizophrenia, and in people who've had, severe viral illnesses in pregnancy. And so, I think it's something to keep on our watch as things develop. Now,
Yeah.
I know that there also may be some metabolic alterations that can occur, and so potentially, because there is a increased risk in neonatal hypoglycemia in some case series of patients with COVID, could that impact overall cardiometabolic health, metabolic syndrome later in life? One
Mm-hmm.
study actually out of BC I found showed increased healthcare utilization for babies that are born from pregnancies with COVID infection. Now, again, there are confounders in that I think people who have had a COVID infection in pregnancy are more concerned about their children. But interestingly, there were also an increased number of prescriptions written for infections, and also emergency room visits for respiratory issues in these patients than people who didn't report an infection. And so I thought that was quite interesting, just in terms of, could there be an impact overall on health, immune function, et cetera. So I think this is something to keep a close eye on. And the neurodevelopmental piece, it's, I think, subtle things on very specific parts of questionnaires for development. So it's less of like a global developmental issue.
Mm-hmm.
The other issue, of course, is that, case reports come out with some very scary things like, perinatal stroke and bleeding in the brain and things like that. And, yes, these may be tied to COVID, but, things get published because they're novel and scary as opposed to being necessarily, common. So I certainly don't think that people should be alarmed either. I think we have to proceed with caution, but definitely keep a closer eye on these kids.
Yeah, and we may not even know until many years later on what's going to happen, because there's a very interesting study on UC Davis gerontology. They looked at the survivors of the 1918 Spanish flu pandemic, and children that had either mothers who had COVID influenza in utero or as babies. And it wasn't until 60 years later that they found there's a 25% increase in these people as adults in heart disease and diabetes and Parkinson's, right? So
Yeah.
we may not even know.
Yeah.
Yeah.
That's exactly it. And so I
Mm-hmm.
think, it's very important that people are doing this kind of research and monitoring
Mm-hmm.
in terms of this big data kind of studies to make sure that we are picking up on any signals that exist.
Mm-hmm. Now, there was a study published last year in 2022 by BC Children's Hospital neonatologist, and they claim that the reason that more infants and children were becoming ill with respiratory illnesses as RSV was that their mothers or parents had not been exposed to infections in pregnancy. What are your thoughts about exposing pregnant patients to viral infections to help give their babies immunity against viruses such as COVID and RSV?
Yeah, so I've looked into this quite a bit because my undergraduate degree was actually in immunology, and so I this was a bit of a puzzling sort of statement to make. So I did look into some of the literature around this. Now, I think in terms of background, RSV is a very significant problem for neonates and young children. And there's a lot of excitement about the development of a vaccine for RSV to be given potentially even during pregnancy to confer immunity. And we'll come down to that later when we talk about COVID vaccine in pregnancy. But I guess the question is well, can we confer immunity during pregnancy, and could that be via infection? And in fact, I haven't really found any good evidence that that's the case. So there was one study that suggested maybe that maternal antibodies against RSV were protective against infant infection, but the antibody titers that they used in that study were actually from 9 to 12 weeks of pregnancy. So it was like their booking blood work that they did. So that would point to RSV infection prior to pregnancy as being what would cause the antibodies, and so not during pregnancy. Whereas, another study, which was, I believe, done out of Australia, they looked at cord blood levels of RSV antibodies. So at the time of birth, they took cord blood, and they looked at, the amounts of these neutralizing antibodies and then risk of subsequent RSV infection. And they didn't find any evidence that higher titers of cord blood antibodies conferred protection against infection. I did also find a study that showed there was a significant risk of neonatal adverse outcomes with third trimester maternal RSV infection. So if a mom has RSV in the third trimester or even at the time of birth, there's a significant risk of neonatal illness and also just generally other respiratory issues. So the other piece is, of course, RSV is a significant infection in some adults. Classically, we think about it as an infection that affects young children and the elderly, but in pregnancy, it can also be a significant issue. There are multiple case series of pregnant people being admitted, and even requiring oxygen supplementation and invasive ventilation with RSV. And we certainly had seen that this past winter was that there were pregnant people that were quite ill with it. So it's not a benign infection, and it certainly would not be something that I would encourage people to try to catch.
Mm-hmm. Yeah, I mean, logically, it would not make sense to infect someone with a virus to protect against a virus, right? Yeah.
Yeah. It
Mm-hmm.
seems counterintuitive,
Mm-hmm.
because we have many successful vaccination programs during pregnancy, like the Tdap vaccine for pertussis immunization. That it's not an infection; it's a vaccination specifically to boost immunity. So, whereas we strongly suggest that people stay away from specific types of infections such as CMV, because that can be extremely damaging to a fetus, especially during specific parts of the development.
So we'll now touch on treatment options. So there was a November 2022 study in the Journal of American Medical Association, JAMA, that found that Paxlovid in pregnant and lactating people was safe. In BC, there's been some new guidelines on Paxlovid use just released this week, and it says, quote, current available therapies have not been evaluated in pregnancy or breastfeeding. But in this recommendation, it was ambiguous whether only pregnant people with immunocompromising condition should receive Paxlovid, or if all pregnant people should receive Paxlovid. So what are your current recommendations about the use of Paxlovid in pregnancy?
Yeah, so in Ontario, where I am, it's the recommendations for Paxlovid in general are very different than in British Columbia. You know, the age cutoff and the types of comorbidities are much broader here. Pregnancy in and of itself is currently a standalone risk factor for Paxlovid treatment if the person is unvaccinated or has had vaccine or infection more than 6 months ago. And so it's very different in terms of access. You know, we've had many patients treated with Paxlovid because we, you know, certainly, you know, the SOGC has looked at the evidence. You know, this is our national body for obstetrics and gynecology. And although, you know, initially the data was scant, the types and classifications of antiviral medication and their mechanisms of action, there would be no evidence of, for instance, teratogenicity or other harms. And in balance with the risk of severe COVID illness in pregnancy versus, you know, a potential theoretical risk, it was felt to be beneficial and worthwhile. And, you know, the study in JAMA, which I think was very, very well done and very well recorded, you know, certainly again didn't demonstrate any safety signal. And so, you know, people are of course wary about any medication during pregnancy, and I think it's been very detrimental, the fact that pregnant people are systematically excluded from medication trials, because we'll never get any pregnancy specific data other than from, you know, emergency use and large pregnancy registries. And that's the kind of evidence from the real world that that I think that can be very useful.
Thank you. Lastly, let's discuss how to keep safe from COVID infection during pregnancy. So there was actually a very recent May 2023 study in JAMA that found that COVID vaccines do not cause miscarriages, but there still seems to be fears about COVID vaccines in pregnancy. How do you counsel your pregnant patients about COVID vaccines in pregnancy?
Yeah, that's a very, very topical thing that comes up so much. There's an immunologist from the UK. Her name is Dr. Vicky Mail, and she does a lot of wonderful science communication online about COVID vaccines in pregnancy. And she keeps a tally of studies looking at safety of COVID vaccines in pregnancy. And she's up to 37 studies now from 9 different countries that that show, and it's including almost 400,000 people vaccinated during pregnancy. It shows actually a decreased risk of stillbirth, a decreased risk of preterm birth, and then no increase in any pregnancy risks, including miscarriage, congenital anomalies, preterm birth, fetal growth restriction. And so, you know, the stance that has been taken by, you know, the major obstetric organizations in all developed countries is that COVID vaccine is safe in all trimesters of pregnancy. And I think that that's really a key message, is that, you know, there isn't any safety signal and that it is safe in all trimesters. That being said, is that there is growing evidence that vaccinating, especially boosting in the second or third trimester, may have a significant benefit for conferring immunity to the neonate, you know, better so than in the first trimester when the placenta hasn't completely developed. And so that's kind of exciting, you know, in terms of making sure that we're protecting neonates, because COVID vaccines currently aren't licensed for babies less than 6 months of age.
That is really exciting news. In BC, mandatory masking in healthcare settings has been eliminated, and there's obvious concerns for immunocompromised people, including pregnant ones. What are your thoughts on this topic?
Yeah, so fortunately, I think most hospitals in Ontario have continued to recommend masks during direct patient care. So I think that BC has a more don't want to say, well, a more anti-mask stance maybe in healthcare than here. But in non-clinical areas, most people have ceased wearing masks. I think that pregnancy is considered a vulnerable state for severe COVID infection, and because of what we've talked about with unknown long-term risks, particularly to the fetus. I would encourage pregnant people to continue wearing masks in high-risk situations, and that includes indoor crowded areas, and that also includes while seeking healthcare. And I think it's most imperative, though, that as healthcare providers, we consider continuing to wear masks when caring for pregnant people in clinical settings, because there are situations where our pregnant patients can't wear masks. I think that during labor, for instance, during C-sections, during times when they're feeling short of breath or having other issues, and so we can at least provide one-way protection with masks. And so I think that patients should feel empowered to encourage their healthcare providers to wear masks, when seeking care, just like with other vulnerable groups.
Yeah, I totally agree. And in fact, Protect Our Province BC has a letter that people can use to request that healthcare providers wear masks and allow them even to use HEPA filters in clinical settings to keep them safe from COVID. This letter is actually available for downloading on our website, and we'll talk about that later. So, Dr. Eastabrook, I understand, and you mentioned that you attended a Canadian conference on pregnancy care. Do you have any exciting information to share with us from this conference?
Yeah, so it was the Canadian National Perinatal Research Meeting, and there were some COVID-specific presentations. There was a lot about different models of care that were developed and impacts. I think from my point of view, the ones that were the most relevant to this were the ones regarding, for instance, the placenta function, with mild COVID in a vaccinated population. I think that is quite reassuring that it doesn't seem to affect placenta function. And then there's a large study out of Ontario that's looking at the sort of the first two waves of COVID, the pre-vaccine COVID population that has collected biosamples from all of these patients that were infected with COVID during pregnancy. They've looked at some of the demographics and outcomes and whatnot. And one of the things that stood out to me was that it seems like vertical transmission in these in these COVID infected non-vaccinated patients in these first two waves, that vertical transmission was actually a little bit higher than we had originally thought. It looked like there it was about 14% of samples that had evidence in the placenta and the cord blood that suggest vertical transmission to the neonate if there was an active infection during labor. So now I don't know what the clinical correlations and the consequences of that will be, but there's certainly going to be some big studies coming out looking at the placentas of these pregnancies, and then obviously the long-term outcomes for the babies as well. So it's very exciting that there's this large biorepository of this sort of original COVID cohort that's being analyzed by a group out of Ottawa. The participation of an incredible amount of people from all over Ontario. So it's a really exciting collaboration that they have going on that I think is going to give some really rich data and hopefully some up-to-date information.
That is really exciting. And now for our listeners, vertical transmission means transmission from mother to child. So, Dr. Eastabrook, are there any last thoughts that you'd like to share with us about COVID and pregnancy?
Yeah, so I think COVID during pregnancy should be something that we have to be cautious about, But I don't think that we have to necessarily be afraid of, like we were, in the first couple of waves of COVID, where it was causing a lot of mortality. So I think there are vaccines available that can be given during pregnancy. I'm hoping that they will get tweaked so that they are up to date with the most current variants. There are therapies that can be used. There's Paxlovid, and then there's also remdesivir, which can also be used in pregnancy. And in a population, where people are highly vaccinated, and where the variants seem to be causing less, at least acutely significant disease, that people are becoming less critically ill. And so I think being cautious is the key, but also optimistic that we can do things to empower our patients and ourselves, to keep one another safe, and that if you do get COVID while you're pregnant, there are therapies and supports available, and in fact most people do very well.
Yeah, that's a great message. So thanks so much again, Dr. Eastabrook, for coming on today and giving us such valuable information on COVID-19 and pregnancy. As I mentioned, Protect Our Province BC has a letter that people can use to request their healthcare providers wear masks and allow them to clean the air with HEPA filters to keep them safe from COVID. And you can find this letter at our website at www.protectbc.ca. And finally, the link to the recording of this interview will also be available on our website. Thanks to all our listeners for tuning in today. Our next live briefing will be on Thursday, June 29th with cardiologist Dr. Leslie Katzal, and the topic will be COVID and your heart. So thank you very much again. And I think we're going to have some questions. So, is there research being done on where the uptick in immune response comes from during pregnancy?
Is that related to like the vaccine immune response, or like the like cytokine storm and acute illness in pregnancy?
I'm not sure if the person has elaborated there.
I believe this was in response to the statement that you had made about when people are pregnant, we see some sort of positive uptick in immune response near the beginning. Cytokine
storm. Oh, okay. Yeah, it's yeah. So there, especially in the Delta wave, when people were becoming very ill during pregnancy, there was this concept of cytokine storms. So particularly in young, healthy people with healthy immune systems, basically your immune system would go haywire and release a lot of very toxic products into your circulation. And in some ways, it behaves kind of in a similar way to preeclampsia, and also to other things like adult acute respiratory distress syndromes, or ARDS, that you would see with influenza. And so kind of similar to H1N1. And so, whether it's pregnancy itself, or whether it's these, young, healthy people with young, healthy immune systems, plus all of the things that happen with your lung capacity, your endothelial function and whatnot, just with pregnancy itself in the third trimester, that seems to be kind of the perfect storm, which is cytokine storm. But that's kind of my understanding of the pathophysiology, but somebody with critical care experience could probably explain more eloquently than I.
A bit confusing to see vaccines are not authorized as safe for newborns, but considered safe during pregnancy. Are there any studies being done on women's fertility and shots?
Yeah, so that's a good point about newborns. I don't know the data. I'm not a neonatologist. I don't know the data on mRNA vaccines specifically in childhood. And it may not necessarily because they're considered unsafe, but there are certain branches of the immune system that don't develop completely until 6 months of age. And that's why certain vaccines aren't given that early, because there wouldn't be an adequate immune response to them. It's the similar thing with the influenza vaccine. Again, we don't give it prior to 6 months of age, not because it's unsafe, but because in fact, there may not be an effective immune response. The other thing is I think that it would be difficult to test and market vaccination for children less than 6 months of age. But again, I don't know the data on that. Whereas, most vaccinations are safe to use during pregnancy. There are very few vaccines that are actually not licensed for pregnancy. These include live vaccines and live attenuated vaccines, because there's theoretical risk that the organism itself could become reactivated and actually cause an infection. And obviously that's not the case with an mRNA vaccine, but those are essentially the only vaccines that we don't give during pregnancy. The second follow-up question was about fertility in COVID vaccines, and there's been no evidence that that COVID vaccination impairs fertility.
Are there any updates on long COVID and pregnancy?
Unfortunately, no. There's a real paucity of research on that. I've spoken with some colleagues that work in the long COVID clinic in my community, and there have been a couple of pregnancies only so far from patients in that clinic. So we're kind of limited to anecdotes and case reports and information from other types of, ME and CFS, and how that may behave in pregnancy. And yeah, anecdotally, some people may actually improve, if we are thinking theoretically that it could be an autoimmune response to COVID, that potentially that pregnancy may improve things transiently. But again, this is all sort of conjecture and hypothesis at this point.
I think someone seems to have missed the beginning of the broadcast, and we were talking, I guess, about pregnancy and COVID being high risk. I think we're talking about that.
Yeah, and I think just to recap, any viral infection in pregnancy can be a potential risk because of the physiology changes during pregnancy, the smaller lung capacity, increased cardiac output, changes to the endothelial system where you get leakier capillaries. And then also, potentially changes to certain branches of the immune system that may leave you more vulnerable. And we know from other infections, like especially H1N1 influenza, for instance, is another bad one during pregnancy that seems to really impact pregnant people. COVID seems to behave the same way. And specifically, the Delta strains seem to really hit pregnant people harder than the other strains, which was quite distressing in terms of illness.
Mm-hmm. And then I think we had talked about also the preeclampsia, which is pregnancy-induced hypertension, and potentially some effects of that COVID.
Yeah, and that's a difficult one to tease out, because the risk factors for severe COVID also have a lot of overlap with the risk factors for developing preeclampsia. And the big question is, what comes first? Is it the predisposition to preeclampsia, or is it the predisposition to COVID, or is it, this perfect storm of these two things coming together and causing this, very significant illness? But there doesn't seem to necessarily be an increased risk of preeclampsia with COVID during pregnancy, at least in the vaccinated population, at least in the Omicron variants. So that's something that's somewhat reassuring.
There's also some interesting studies to do with placental engorgement related to COVID in pregnancies. Can you comment on that?
Yeah, so there have been a lot of pathologic studies looking at pregnancies impacted by COVID. It does seem, again, that the Delta variant had specific trophism to the placenta with like chronic vilitis and actually potentially even COVID infection of the placenta. I don't know a lot of the details about our large, Ontario study that will look at these pathologies. A lot of the case reports and case series looking at some of these really profound placental lesions were in people who were very ill with COVID or who had very poor perinatal outcomes related to COVID. So I can't say that this is a kind of a global thing that happens, but certainly, the risk factors are, again, unvaccinated, Delta wave causing an actual specific COVID pathology to the placenta.
Mm-hmm. And then I know when you're speaking about the neurodevelopmental potential issues with the fetus, there seem to be some studies that seem to be showing it was sex specific, more predominant in male fetuses. And any kind of thoughts about why this would be the case?
Yeah, so interestingly, most neurodevelopmental issues, do tend to cluster more in males versus female in general. And there's a lot of thoughts about, even in utero, there are certain other types of insults that can happen that, again, male fetuses tend to be more vulnerable to than female. And there's even changes in the placentas that it can occur that are sex specific as well. So I don't know whether it's just simply that this is what we see with most neurodevelopmental things, that it does tend to skew more towards male sex than female in childhood, or whether there's something more specific to COVID. It's hard to know.
Okay, I think that's all the questions that we have, but thank you so much again, Dr. Eastabrook. That was just a wonderful presentation on COVID and pregnancy, and thank you for joining us. And again, thanks very much to our listeners for staying tuned and coming on. And our next session, live briefing, will be on June 29th, and it will be on COVID and your heart with Dr. Leslie Cassell. So thank you very much again, everyone, for listening in.